who has the great honour of being the first principal here at Aldinga Bayindi College, and I know that there's going to be some very, very excited people when they come back to school. I've just had the great pleasure of having a look around this site. It is incredible. Every detail has been worked through with staff, with students, and now we can see it in action. Of course, we need to stress test it when the students return, and students will be returning here on the 31st of January, and then for face-to-face classes to start on the 2nd, with the final students coming in, of course, on the 14th. One of the things about this school is I think the majority of students will be returning for face-to-face classes on the 2nd, because this is a school which will have, of course, receptions and 1s and 7s and 8s, and that makes up the vast majority of students on this campus. There will be some others in year levels 2 to 6, but they make up the minority of the people that will be back, or back till we get to full strength on the 14th. But this is a school which this year will stop at year 8, and then each year thereafter it will increase the overall size of the student population. Students are going to love this site. Everything that they could possibly need, from fantastic gym equipment, incredible classrooms with great breakout spaces, art classes, incredible sporting facilities, an AFL-sized oval, underlights, soccer pitches, netball courts, tennis courts, basketball courts, everything. What I particularly love is the way that the thought has been put into creating outdoor learning spaces. Now, we all know ventilation is absolutely crucial as we deal with Omicron. There are so many opportunities for staff and students to continue their learning either in highly ventilated spaces or, of course, outdoor areas. This is a glimpse into the future. That future is right now here in South Australia. I'm going to pass over now to John Gardner, and then I'll come back a little bit later. Yes,
so just to celebrate, today is the commercial acceptance of this outstanding new facility, delivered on time, on budget, and indeed for the students here at Aldinga Bayindi, and also Riverbanks College in the northern suburbs, Whyalla Secondary College and the Goolwa Secondary College, all opening on day 1, term 1 this year, our 4 new public schools. It's a very exciting day for public education to celebrate the commercial acceptance today. Absolutely ready for the kids to come back next week. Ali Colbeck's done a tremendous job over the last year getting this school ready. There's a teaching staff of approaching 100 teachers and SSOs and other education staff here at Aldinga Bayindi. Anna and Alice are teachers who are with us here today, and they and the other teachers, I think, are very excited about these wonderful facilities. I'm sure, as the Premier is, that these students will be looking forward to coming next week and experiencing them. Here at Aldinga Bayindi, we have over 500 students across the year levels. Because they are full cohorts at reception in year 1 and 7 and 8, they are large cohorts. Years 2 to 6 are actually only 1 class per year level here at the school as it grows up. So this and Riverbanks will be exceptions to the norm, indeed, as it terms to the proportion of students coming back. I suggest now, if you'd like to talk to Ali Colbeck or have any questions for me about Aldinga, then we can deal with that. If there's any specific education questions, I'm happy to deal with those as well in relation to the return to school plan. But obviously the Premier will have other COVID updates when he comes back.
Just while we've got you then, we're obviously going to find out a little later today what the AU membership has decided with regards to a strike on the 2nd of February. What's your message to any of those teachers standing out there this afternoon who might still be unsure about which way they're going to vote in the ballot?
Look, I think that it's been a significant body of work through the department and the government, and indeed the AU leadership, in talking constructively in recent days. It's unfortunate that the ballot was called on, I think, too early, and indeed we've been able to resolve a number of the issues that were raised last week by the AU leadership. I think one of the most significant issues raised by the AU was in relation to the use of rapid antigen tests for surveillance testing in schools, and this government has, as we have throughout the pandemic, listened to Professor Spurrier and the health team in supporting our educational our educational facilities. We are listening to Professor Spurrier and her team in the way that we're using rapid antigen tests in schools, and I think it would be a mistake to go against the strong and clear health advice in relation to this. Now, I'm optimistic that the union and indeed our teaching workforce who will have the opportunity to hear from Professor Spurrier this week. Professor Spurrier and the Education Department have reached out to the union to offer them a direct briefing from Professor Spurrier, and I hope that they'll take up that opportunity. And indeed, the clarity that Professor Spurrier, I think, spoke on Friday at the press conference about why she gave the advice that she gave, the fact that we don't want to have people taking a false level of comfort from using the rats in a way that they weren't designed to be used, and therefore not put in place the behaviours that we want them to put in place. I'm very confident that that will be very persuasive. Look, at the end of the day, our purpose, all of our purpose, is to ensure that our kids get a great education. We know that that is delivered best face-to-face, and it is so important that we do so in a way that listens to the health advice. It's really important this year that parents not send their kids to school if they're sick. It's very important that indeed, if people are symptomatic, they not come to work. We'll continue to listen to Professor Spurrier and her team to get the health settings right in our educational settings.
Minister, are you still confident that the school year will be able to restart for the rest of the students as planned on 2 weeks after the staggered start?
Yeah, absolutely. So the purpose of the staggered start is to ensure that the spread of community transmission of COVID does not see those extra 20 or 30,000 cases that the modelling suggested that we would see on day one if everyone returned on day one. We're very confident that as we pass that peak of Omicron transmission, we will be able to do our bit to suppress the spread by having that staggered start. But it is so important we have all our kids back on the 14th of February. And so far, certainly the health advice has very strongly backed up that we'll be able to do that. And indeed, our kids will be the beneficiaries of us getting education off to a great start this year.
You said in the past week you've resolved a number of issues with the union. What issues have been resolved?
Look, I wouldn't want to preempt the detail of those discussions, which are in fact ongoing. But the union raised, I think it was in order of 19 issues with the Education Department. Formal responses have been provided to those issues. Now, there are some things that we have said from the start that we're not able to change. We do want to have learning going back for our students on the 2nd of February because it's critical for their educational entitlement, especially in those transition years. We've also said we'd like to continue listening to the health advice in relation to rapid antigen tests. But on matters such as ensuring that there are methods of communication between the union and the Education Department, a number of the things that the union has asked for are indeed part of our COVID-safe plans anyway. We've taken a very proactive approach to encouraging parents to get their kids vaccinated. That's one of the things that the union was asking for example. Those sorts of things we're able to resolve because we're actually all on the same page. I'm very confident that a number of the other issues that remain at difference will be able to get closer in the coming days, and I hope that whatever the result of the ballot may be today, that the union executive, who I understand are meeting tomorrow morning, will take into account that very constructive level of discussion that we've had in recent days, and I hope they'll take the opportunity to listen to Professor Spurrier explain to them why she's given us the health advice that she has.
If there is a strike and the union delegates decide to go ahead with it, what are the contingency plans in place for that?
Well, to be clear, I don't think that we're at that stage yet. Irrespective of the result of the ballot this afternoon, the union executive has said that they're going to be meeting again tomorrow and discussing further the issues that we've been resolving in the last week. And I think that if you look back at any set of industrial actions that have happened in recent years, it's one thing for those who vote in a union ballot to put forward their opinion, but the overwhelming majority of our educators have always expressed a desire to support their students, and I know for a fact that our educators in South Australia are very passionate about their students' well-being. That is best served by being on the job and supporting that learning in school.
So you don't anticipate there being a strike you anticipate that they'll call it off?
I think that it's too early to say that there will be. The ballot hasn't closed, and I'm confident that as we've worked constructively with the union over the last week since they've announced this ballot, I trust that they'll take that into account, and the fact that we've resolved a number of issues that were in fact on their list of concerns when they called for the ballot in the first place.
What will stop schools returning on February 14th in full?
Well, to be clear, the purpose for the staged transition back to school is to acknowledge the fact that we want to reduce that level of community transmission of the Omicron virus in our community. That's based on the modelling that suggested there would be a peak at or about now, and indeed, as it appears that we've moved past that peak, that modelling appears to be correct. So I don't see that there is any likely scenario where we won't be back on the 14th of February. Certainly the health advice that we have had to now, that we've been listening to, has been, I think, matched by the outcomes of the modelling that has been offered. The modelling said we'd be past the peak by about now or soon thereafter. It appears to be the case, and that suggests that as those numbers drop, certainly below the threshold where we thought they might be, we'll be in a very strong position to have great confidence returning to school for all of our students on the 14th of February.
Are you allowing principals to decide if years 2 and 11 also attend school on February the 2nd?
So there's a couple of very specific circumstances that have been identified. Some students, and it's not a large number of students, but some students are doing Year 12 subjects while they're in Year 11, and we've identified that those Year 12 subjects obviously are able to be taught in a face-to-face fashion, and that would be the case for students studying those subjects. That's a fairly limited set of circumstances. There's not a large number of students that we're talking about. In relation to the issue of Year 2s, I think what we're envisaging is, in relation, like Port Neal Primary School, for example, I'm not sure what the numbers are this year. Last year they had 9 students and a composite class for the receptions, 1s and 2s, for example. So certainly we're not envisaging that the purpose of the stage transition would be gotten in the way of by making a sensible local decision in a case like that, to have the Year 2 student able to join their colleagues. There may be, Port Neal Primary School is not the only school in that circumstance, so we're creating, I guess, the room for sensible local decisions to be made, so long as they are within the spirit of the health reasons why we've staged the transition back to school.
Thank you. Just to go to you with a breakdown of the COVID update today.
You didn't want to chat with Ali at all?
We'll come back to Ali.
Come back to Ali, all right. So I can give you the COVID update today, and there is some very good news throughout it, but sadly I've got to begin with 2 deaths. A woman in her 40s, I understand this will be referred to the coroner, and a man in his 70s at a residential aged care facility. But the good news is that our positive cases are down to 2,009. This is certainly the lowest we've seen for a very long period of time. 1,465 came from PCR tests, and 540 were identified with the rapid antigen tests. Importantly, and I think this is a very important statistic to look at, in the past 24 hours, 3,508 recoveries have been recorded against 2,009 positive cases. So we're really reducing the number of active cases by thousands and thousands each week. In fact, at the moment, we're down to 27,991 active cases in our state. You would remember just a few days ago, we were up over 3,500. In hospital, we have 294, so there is an increase there, and 1 more in ICU, up to 29, with 6 people on ventilators. In terms of our testing, there are virtually no delays in terms of getting a PCR test in South Australia at the moment. So my strong advice to every single South Australian is, if they have any symptoms whatsoever, go and have that PCR test. Getting onto cases as quickly as possible, as accurately as possible, is our priority. There are no delays. In fact, yesterday there were only 9,756 PCRs, and that's between SA Health and the private labs. Don't forget, going back 4 weeks ago, we were up around 26,000 tests per day. So there's plenty of capacity, and those results are coming through very, very promptly at the moment. In addition to that, the Police Commissioner informs me that he handed out 4,005 rapid antigen test kits, and of course that has 2 tests to be administered on day 1 and day 6, so a total of 13,761. In terms of vaccination, well, there's some very good news for those people who have been waiting for the Novavax. I reported to you last week that the TGA had approved it, then needed to go to ATAGI, the Australian Technical Advisory Group on Immunisation. It went there, it's now been approved, and so we should see from February 21st those Novavax vaccines being available here in South Australia. We're just working through those final arrangements, but we think from February 21st. That's certainly when the Commonwealth has advised us that we can start using the Novavax vaccine. Yesterday, we did 10,393 doses, or administered 10,393 doses. Obviously, Saturdays and Sundays are lower than usual because we don't have as many GPs and pharmacies offering that service. But I can tell you, both yesterday and Saturday, we had very strong SA Health vaccination rates. In fact, Saturday was a record, 9,406 vaccines administered. And again, we have massive capacity for vaccines in South Australia. We now have already sailed past 50% of the eligible population have had their booster in South Australia. Don't forget, it was only a week ago that we massively opened up for another 255,000 people to immediately become eligible. Well, we're back over 50%. So there is really now no time delay whatsoever. If we go back 3 weeks ago, there was massive excess demand. People were saying, look, I'm not going to be able to have myself boosted before I go back to work, or I'm not going to be able to have my child immunised before they go back to school. There is massive vaccination capacity in South Australia. We've significantly flexed up those appointments, and so my strong advice to people is to go book in or even turn up at one of our max vaccination clinics. You'll be welcome with open arms. In fact, no, we won't touch you, but we will be welcoming you there, because we know that the more jabs that we get into people's arms, the safer we're going to be here in South Australia. And some other very good news, which is we continue to see the decline in the number of SA Health staff who are COVID positive or who are furloughed. So if you go back a week or so ago, we were heading towards 1,000. In fact, I think we might have even gone over 1,000 staff furloughed. At the moment in SA Health, especially in those metropolitan settings, 522 in total, and that includes 356 who are positive. And again, that's a very significant decline in COVID positive and furloughed staff across SA Health. It means that this week in the COVID Ready Committee, we'll be looking at a range of topics. We'll obviously be getting some further modelling back from Professor Ross with regards to how we may set about easing restrictions in South Australia. We'll have a discussion again about Aboriginal and Torres Strait Islander communities and more vulnerable communities across South Australia. And we'll also be looking at elective surgery. Not to remove the ban completely, but just looking at the pathways back to removing elective surgery bans in South Australia. We were the first to lift the ban last time. As you can see, we still need capacity in our hospitals. Plan 500 is working extraordinarily well. And don't forget, Plan 500 only relates to the adult population. There are paediatric beds and ICU beds as well on top of that 500.
On those hospitals, the numbers in hospital remain about the same as they have over the past couple of weeks. They're not reflecting the reduction in new cases. Is there going to be a lag between those two catching up with each other? And how long before the number of hospitalisation starts reducing in line with the number of new cases?
It's a really interesting question, and you're quite right. There is a lag from the time from symptom onset into hospitalisation. But what we're also seeing now is an increasing number of people who are admitted, and included in these statistics, who are admitted not because they're COVID positive, but they just identified as being COVID positive when they're in there. So I think at the moment we're running at around about 18% of people that are in our hospital system that we do report, because we've used this reporting mechanism since day one, but they're not there because of COVID. They're there with COVID, and so we probably do need to separate those out for you so that you can look at it. We've definitely got capacity in our system at the moment.
But have we passed the peak in hospitalisations? I
think we probably are at that peak, or have passed that peak in South Australia at the moment. But don't forget, there are two issues which are going to impact in the coming days. First is a gentle and gradual return to work starting on the 27th, where 25% of people who have previously been working from home will be going back to their offices and their workplaces. That's going to increase mobility. And the second one is, of course, the students returning to school on the 31st, the 2nd and the 14th. Now, we did previously advise that Professor Ross had modelled up the return to school, and there was no significant noticeable effect in terms of those total numbers. There will, as Professor Spurrier said the other day, possibly be a shift in the age for those cases, that we might see some more paediatric cases in line with more students going back to school.
Premier, does Victoria and New South Wales introducing surveillance testing in the school setting give you any pause for thought about their return to work plan you've got? Return to school plan, I should say.
Now, look, every state has to make their own decisions on what their settings are going to be. In South Australia, we've been very deliberate since day one to listen to the health experts. That's put us in a very good stead here in South Australia. Don't forget, the health advice back in 2020 was for students to return to face-to-face learning. Many other states said, no, we're not going to do that. We did it in South Australia, and I think that our students ended up with a better education. In this instance, we have advice from the AHPPC, from the Chief Medical Officer for Australia and from our own Chief Public Health Officer here in South Australia, Professor Spurrier, and they're all exactly the same. The false negatives, the rates of false negatives with the RAT test can give people a false sense of security. The most important thing they can be doing is abiding by the very careful set of public health measures that we have advised, and I think that we will do very well. So we won't be following New South Wales, we won't be following from Victoria. We'll be continuing to follow that expert health advice in South Australia.
About the fatalities we've recorded in South Australia, by my calculations, I think we're up to about 69 fatalities since coronavirus was first discovered in South Australia. Are you any closer to knowing what the breakdown of those fatalities are, Delta relative to Omicron strain? Have you got that?
I don't have those off the top of my head, but at the moment, Delta is probably less than 10% of all the cases that are presenting. We don't really have any information that after the Omicron wave goes through whether or not there is going to be a further Delta wave. But of course, by then, we're going to be at a much higher vaccination rate. I can't tell you how delighted I am with the vaccination rate in South Australia. I'm even more pleased that there's massive excess capacity. So if there is anybody watching this feed or any of our friends in the media can just emphasise as much as possible, there are tens of thousands of appointments that are going begging. In fact, I think there's 16,000 vacant appointments this week alone. So at the moment, we're up over 140,000 vaccinations which are being administered in South Australia each week. I've got to thank our friends in the pharmacy sector and also our wonderful GPs for the great work that they're doing. South Australia disproportionately vaccinates through our own clinics, which has allowed us to move very quickly. At National Cabinet last week, the Chief Medical Officer made it clear that for the whole of Australia, about 66 or 2/3 of all vaccinations are done within GPs and pharmacies. In South Australia, it's 50-50, so we're massively outperforming the national average in terms of the number of vaccinations that we're doing within SA Health.
You mentioned that some restrictions.
Yes.
Professor Ross is going to be doing some modelling on restrictions. What do you envisage will be relaxed first, and do you have any timeframes of when you would like that to be introduced to the wider South Australian public? Well,
obviously, what we've always tried to look at with any of our restrictions is what are the health impacts, what are the economic impacts, and what are the wellbeing impacts. So what I've asked for is modelling that gives us some options so that we can start making some decisions which is going to optimise that path. We can't remove all restrictions at the same time. That would just lead to a second and damaging wave in South Australia, and then we'd be putting them back in place. So we've, if you like, cut a prudent path with return to work as of this week. I think most other states still have their work from home rules in place, so I think we're leading again with regards to that. Students are going back to school in South Australia. We'll look at the implications of that on the model, but clearly we have other restrictions in place in South Australia. Density arrangements, the number of people that are allowed back at work, caps at home. These are all of the things that we need to look at, but I can guarantee you in each of these scenarios we'll be looking at what's in the best overall for South Australia.
When do you anticipate, sorry Andrew, when do you anticipate getting that modelling to show those different scenarios back?
So it's a good question, because usually what we do is we receive an interim report and then a final report. We hope to get that interim report this week, and then there's a lot of questions. It is a really detailed model. I've got to say we're very fortunate in South Australia to have the unit of applied mathematics at the University of Adelaide. It is nationally and internationally regarded. Professor Ross himself is part of that overall Doherty Institute family. He's had input into the original national framework that led to us deciding to open on the 23rd of November, when we got to 80% of our population 16 and over double vaccinated. So he had an intimate understanding of how that worked. But what we've now got on top of that is a specific South Australian forecast, and as I said, we're very fortunate to have it. Andrea?
Has Professor Ross been given a specific date to aim for about, the implications of lifting restrictions at that specific date? For example, as you said, with school returned and with people heading back into the office? So
it's a model and it's a forecast, and we keep putting actual data. Every day, actual data goes in. When we make a decision, like getting 25% of people back into the workforce, again, that goes in. The students, now that's all clarified, that goes in as well. But then what we've asked them to do on top of that is to model various other relaxations of restrictions, and we'll be able to make that determination. I'm not sure whether it will happen later this week or early next week, but the reality is I think people want a clear pathway of where we're going from here. The really pleasing stat is that we now have a very much reducing daily positive rate. And we're operating well within our hospital capacity. Now, that is a flexed up and enhanced hospital capacity because we have taken some beds from private hospitals and we have cancelled non-urgent elective surgery. So we want to get those things back into place as well. But clearly, the restrictions that are in place are still causing great stress on many individuals and families. We don't want to keep them in place one day longer than we need to. But when I think back to the discussions that we had on the COVID Ready Committee on the 23rd of December and Boxing Day, I've got to tell you there's a lot of relief around that committee that we have been able to change the trajectory here in South Australia. And it's really pleasing that governments around the country, around the world, are looking at what we've done here in South Australia. I think every South Australian can share a great sense of pride for a job well done so far. We can't be complacent though, and that's why I say any symptoms today, please go and get yourself tested. And if you haven't been fully vaccinated, or if you haven't had your booster, or if you're a parent of a student going back to school later this month or early next month, please go and have that vaccination. It is our absolute front line in terms of protection for our state.
How crucial will it be for us to at least have some of the capacity restrictions and the home gathering restrictions lifted well before the election? How crucial is that to you?
No, look, our focus since day one has been on keeping South Australia safe and our economy strong. You would have seen today with the ComSec State of the States report, this is the best result South Australia has ever achieved. Ranked number 2 in the state. When we came to government, we were always 5th or 6th. We're now ranked number 2, and my ambition is for South Australia to be ranked number 1, but we're not going to compromise the health of the state. We're not going to have a massive second wave in South Australia, so we're going to get that balance right.
Less than 2 months before the election, are you concerned that you're losing the business leaders and small businesses who would normally be backing you in at this point? Is this a concerning turn, I guess, because of your handling of COVID in recent months?
Well, look, I think our economy in South Australia has been the strongest it's ever been. Last year we had the strongest economic growth of any state. That's the first time that's happened. We've got the lowest unemployment rate in the history of South Australia. We've got a net migration back to South Australia. We've got record exports. It doesn't mean that every single business is doing well, and some, I acknowledge, have been very significantly hit. But overall, virtually every metric that you look at, South Australia is really on a very good trajectory. We have got some challenges ahead. We have got to be very clear that we've got to come through this Omicron wave, and we've got to make sure we're as prepared as possible for any subsequent waves with regards to COVID-19. But I genuinely feel that South Australia is heading in the right direction.
Can I just ask Theo Maris and his comments and turning to Labor at this point?
I think if you look at the record, Theo Maris has probably been turned to Labor for quite some time.
Can I ask you about the restrictions and the potential matrix of the makeup of
Yes.
easing of restrictions? What do you anticipate being looked at first? Is there any home gathering caps or density, or is it going to be sort of like a easing of different areas across the board?
Yeah, so as I was saying before, what we've done is ask for options, and let's see what comes back from the modeller. Let's just see what he presents, and then we'll be able to make informed decisions from that. But clearly, some of the restrictions directly relate to employment. And so from my perspective, I'd really like to look at the density arrangements before I looked at the home caps. Now, I know that might not be popular with some people, but genuinely, when we look at the density, that is what is definitely related to employment in South Australia. And so we want to get as many people back to work in South Australia as possible. We know that we've got almost full employment in this state with the statistics which came down last week. That's not going to stay there with what has happened subsequently to that, but we want to get back to this position of an unemployment rate which is at the lowest level in the history of state as soon as possible.
Louise, we just a different issue, namely the weather event that has swept across South Australia in the last 48 hours. Has the government given any consideration to direct financial support on top of anything that might come from the federal government? And we've heard from one particular Eyre Peninsula council that they're concerned that it could take up to 10 years to repair some of the road and infrastructure damage that they have suffered. So can you talk us through where the state government has already got to on that front?
So obviously we've had some pretty extreme rainfall in South Australia over the last couple of days. In Cabinet this morning, Minister Wingard gave an overview of information that we have received to date. Also, Minister Basham is the Minister for Regional Affairs. It's still too early to say what the total impact on South Australia will be immediately and then over the medium term. Our priority is to get those roads and other critical infrastructure in place as quickly or repaired and activated as quickly as possible. I couldn't stay for all of Cabinet today because I had Professor Dean Jench's funeral to attend, but we had already started to receive that report. I'll get a briefing later today. But the critical thing is we want to get behind and support those communities who are most impacted, both from an infrastructure perspective, but we're also hearing about some soil erosion, particularly on the Eyre Peninsula. We want to see what the options are for leaning in and supporting these communities at this pretty tough time.
Well, we understand that the rail line between South Australia and WA and South Australia and the Northern Territory have both been very severely damaged.
Yes.
Were you briefed about any potential impact on supply chains because of that, and how long do you expect that's going to take?
Look, we have had outages on these lines before, and so we've got good recovery contingencies in place, but it's still too early to say exactly how many days different pieces of infrastructure are going to be out for.
Louise Hinks, the CFS volunteer who died down Lucindale, is coming home to Adelaide with honour guards along the way, I believe. Is this a reflection of the value that South Australians do put on those volunteers and the work they do?
I think every South Australia joins in mourning the loss of Louise Hinks. She was a South Australian hero. She signed up to the CFS as a teenager. She loved the CFS. Whenever there was a call for a volunteer, she took up that call. She worked on fires, not only in her own area, but on Kangaroo Island, the southeast. She went interstate to do what she could. Obviously, an extraordinarily sad time for her family and her friends, but for also the broader CFS and SafeCom family. She was much loved. She worked within SafeCom as well as being a volunteer with CFS. Can I just say, so many South Australians put their lives on the line to protect our lives and our properties. The CFS, along with organisations like the SES, do such an incredible job as volunteers, and so I think all South Australians will join in mourning this loss, but also celebrating a life well lived.
Can I just ask you on another topic briefly? Department of Infrastructure and Transport officials fronted a Budget and Finance Committee meeting this morning. Evidence was given that the Gawler Rail electrification is a further $127 million over budget. How can that happen?
Well, I think you should ask the former government how that could happen. The shoddy work in preparing the documentation for that contract has left South Australia extraordinarily vulnerable to these cost increases. And then on top of that, of course, we've had some very significant issues associated with COVID, especially in terms of getting some very specialised talent into South Australia. So there have been issues that have plagued this project, but I'm actually very hopeful that it is now going to be finished in the coming months, and the rail electrification project, originally promised by Labor more than a decade ago, will finally be delivered by this government.
To be fair though, you your government's had coverage of this for the last 4 years, and you've seen not only this blowout, but a further previously announced $100 million. So you're $250 million over the original budget. So that is a huge blowout.
Rory, I just have to stop you there. We're $250 million over Labor's budget. This was a very shoddily constructed contract delivered just a couple of days before they went into caretaker. The detailed design work wasn't there on this important project. It is an important project. It's why on coming to government we didn't scrap it. We thought this is messy, but we will continue to work with the contractors. There's been a change of ownership of those contractors. There's been a global pandemic, and it is going to be a fantastic service once it's delivered.
Is criticising the performance of the minister, and they say that he should go and you should fire him. What's your response to those claims from them?
I take advice from a lot of people, not from the opposition. Thank you. All good.